Welcome back to The Explainer, everyone. Today, we're doing something really exciting. We're taking complex clinical pharmacology and making it totally accessible. We're going to break down exactly how 7 specific, evidence-based herbs target the absolute root causes of Polycystic Ovary Syndrome, PCOS. We're completely skipping the guesswork today and looking right under the hood at the biological mechanisms. All right, here is our roadmap for today. We'll start by decoding systemic PCOS, then look at herbs for insulin sensitization, followed by restoring hormonal equilibrium, the stress-androgen connection, and finally, a really crucial look at herb-drug interactions and safety. Let's get into it. Section 1, decoding systemic PCOS. To really get a handle on this condition, we first have to totally reframe how we view it scientifically. You know, if you've ever felt like standard treatments are basically just slapping a Band-Aid on your symptoms, well, there's a reason for that. The really crucial point here is that PCOS is not just an ovarian issue. Honestly, the name itself is kind of misleading. Modern clinical science now recognizes it as a massive systemic, metabolic, and stress-related syndrome. Yes, it's driven by that classic triad, hyperandrogenism, chronic anovulation, and polycystic ovaries. But if you look beneath the surface, it's actually fueled by insulin resistance, chronic low-grade inflammation, and oxidative stress. Treating just the surface symptoms without hitting those systemic roots, well, that's exactly why traditional treatments can feel like they fall short for so many women. Consider the data from a recent prospective clinical study done in a community hospital setting. It's comparing an integrated Ayurvedic approach straight up against standard allopathic care, your typical oral contraceptives and metformin. The results are actually wild. We're talking a 70% improvement in menstrual regularity using Ayurvedic management compared to just 55% with standard care. And as a huge bonus, the Ayurvedic group experienced significantly fewer side effects. Pretty amazing, right? Moving on to Section 2, herbs for insulin sensitization. Let's look at how specific botanicals tackle metabolic dysfunction, which, as we know, affects a huge majority of people with PCOS. All right, so here is our metabolic powerhouse trio: berberine, cinnamon, and turmeric. What's so incredible about these herbs is that we can directly map their active natural compounds right down to their precise pharmacological actions at the cellular level. We aren't just waving our hands saying, hey, these are good for you. No, we are seeing exactly how they function inside the body to fight off insulin resistance and inflammation. Let's zoom in on berberine for a second. You can basically think of it as a metabolic master switch. It actively flips on the AMPK pathway. Now, if that sounds familiar, it's because that's the exact same cellular pathway targeted by the pharmaceutical drug metformin. By turning on this switch, berberine massively enhances how well your cells pull glucose out of your blood. Studies are showing that a dose of just about 1 gram per day can actually stabilize blood sugar, improve your lipid profile, and really drive down that insulin resistance. Now, consider how cinnamon and turmeric team up. They complement each other so well. Cinnamon's bioactive compound, cinnamaldehyde, literally mimics insulin. It increases the phosphorylation of insulin receptors, which is just a fancy way of saying it directly forces glucose into your cells, bringing down both fasting insulin and HOMA-IR scores. Turmeric, on the other hand, steps in using curcumin to cool down that chronic low-grade inflammation we see in PCOS. It suppresses those nasty pro-inflammatory cytokines and literally protects your ovarian tissue from oxidative stress. So, together, you're tackling the blood sugar spikes and putting out the inflammatory fires driving the syndrome. Section 3, restoring hormonal equilibrium. So, we've hit the metabolic root. Now let's see how these botanical interventions get the endocrine system and the reproductive cycle back on track. When we impartially compare ovulation success and cycle regularity between standard pharmaceutical treatments like Clomid and Letrozole and targeted herbal options like Shatavari and chasteberry, a really fascinating picture emerges. While the pharmaceuticals definitely show higher sheer ovulation induction rates right out of the gate, the herbal treatments offer this incredibly strong complementary approach for long-term cycle regulation. Plus, they come with a much milder side effect profile, making them an excellent choice for sustained hormonal balance. Let's shine a spotlight on Shatavari. It's widely revered as the queen of herbs in Ayurveda, and guys, this is not just ancient folklore. Shatavari is absolutely packed with steroidal saponins and phytoestrogens. Clinical trials actually show that this powerful reproductive tonic stabilizes the hypothalamic pituitary ovarian axis, the HPO axis. In one really rigorous 12-week trial, taking the supplement significantly dropped the number of abnormal follicles and thickened the endometrial lining. Basically, it creates a much more welcoming uterine environment for anyone trying to conceive. Okay, let's talk about excess androgens. These are what cause those really frustrating symptoms like stubborn acne and facial hair. Spearmint and Vitex are your biochemical tools here. Spearmint tea literally acts like an enzymatic roadblock. It inhibits the 5-alpha reductase enzyme. That stops standard testosterone from converting into DHT, which is the super potent form that triggers those symptoms. Meanwhile, Vitex, also known as chaste tree, is working higher up the chain. It targets the pituitary gland's dopamine receptors to drop prolactin levels and correct the ratio of luteinizing hormone to follicle-stimulating hormone. It is literally paving the way for regular ovulation. The metrics actually show that integrating these multi-targeted, holistic therapies leads to highly competitive outcomes. While frontline drugs like letrozole are fantastic for immediate fertility needs, incorporating supplements like myoinositol and herbs like berberine proves that fixing the body's underlying environment leads to incredible, long-term reproductive success. Moving into Section 4, the stress-androgen connection. This is a super fascinating piece of the puzzle, the critical yet totally overlooked link between our adrenal glands, our stress, and our reproductive health. 28%. Just let that sink in for a second. That is the massive percentage drop in serum cortisol levels seen in just 60 days for patients using ashwagandha in a randomized trial. But why does a drop in the stress hormone matter so much for PCOS? Well, it matters because PCOS is heavily influenced by the hypothalamic pituitary adrenal, or HPA axis. When you're constantly stressed, your cortisol spikes. High cortisol drives up insulin resistance, which then turns around and tells your ovaries to crank out more androgens. It's a vicious cycle. Ashwagandha is an adaptogen that basically steps in and snaps that cascade in half. And there's the crucial part. Unlike what it does in men, ashwagandha does not elevate testosterone in women. By calming down the central nervous system's stress response, it actually helps lower androgens in female patients. It's a total game changer. Finally, Section 5, herb-drug interactions and safety. Because these herbs pack some serious, real-world pharmacological power, we absolutely have to talk clinical safety protocols. Natural definitely does not mean without risk. Listen, if you're currently taking prescription medications, please pay close attention here. Combining berberine or cinnamon with a drug like metformin creates an additive effect. That can crash your blood sugar fast, leading to severe hypoglycemia. Also, cassia cinnamon in high doses contains coumarin, which can actually be toxic to your liver. What about Vitex? Well, it can alter how your body metabolizes oral birth control, messing with its efficacy. And licorice root, which is often used to lower testosterone, can dangerously mess with your blood pressure if you combine it with spironolactone. So always consult your healthcare provider before mixing these protocols. I absolutely love this quote from the literature, so I had to highlight it. It perfectly shows that treating PCOS isn't just playing whack-a-mole with isolated symptoms, and it's definitely not some strict either-or choice between modern medicine and traditional herbs. Getting the body's stress, metabolic, and reproductive axes back online is a unified process. And the best part? We now have the modern biochemical tools to understand exactly how these ancient botanicals are doing their heavy lifting at the cellular level. So I'm going to leave you with this to think about. How could a multi-targeted, integrative approach, one that merges cutting-edge clinical pharmacology with traditional botanical wisdom, completely redefine your own health journey? Thank you so much for hanging out with me for this explainer. I genuinely hope seeing this systemic breakdown empowers you to safely explore all the evidence-based avenues for hormonal balance, hand in hand with your medical provider. Stay curious, stay informed, and I'll catch you in the next explainer.